My chapter is about how decision making at all levels in the organisation has to be based on prudent principles. So it's not just about understanding what healthcare and prudent healthcare means, but actually living it in the way that we make day-to-day decisions. I think people might be surprised that the accountability is very clearly ascribed to boards, but actually also clearly ascribed to every interaction between a member of staff and patient. Prudent healthcare is a combination of culture, systems, processes, and a set of principles that need to underpin decision making at all levels throughout organisations in the NHS, but particularly for boards. There are a number of factors that we've got to take into consideration in the wider context. This is about striking a new deal and a new partnership with our staff and with the public about what they can expect from the health service and what the health service can and should be delivering for them. It's about an understanding that we have a shared responsibility for health, that none of us are passive partners in our own health and healthcare, but that we have to be active in doing our own bit so that we're sure that the resources that we have available for healthcare are directed at the things that are going to really make a difference to people's lives. I think the other really big issue for us is in terms of our staff, being really clear that people are putting prudency at the centre of the decisions that they're making, the types of treatments that they give, or perhaps even whether or not they treat at all. You talk to people in their own lives outside of the health service, and people tend to make very prudent choices. They tend to cut their cloth and make decisions about what they're going to spend their money on, depending on what their priorities are. What we need to do is for people to translate those everyday common sense principles into their lives working within the NHS, but also into their health-seeking behaviours. So if you know that something that you do in your everyday life is going to create a healthcare problem that is then going to require the NHS to spend resources on you, if that was your money, you might think differently. But what we're actually asking people to do here is to recognise that the health service is all of our resource. We own it, all of us together, and we've got to make sure we use it wisely. What this is about is doing the right thing that is going to give us the greatest benefit. And what I've tried to do in my chapter is give some very small case studies to try and describe in real terms what that might mean for staff and for patients. For prudent healthcare to really work as a philosophy rather than a buzz term, we have to, every single one of us, believe in it, and not just believe in it, but live it in our day-to-day lives, both as healthcare professionals and as citizens of Wales.